The sufferings of abuse, depression, and anxiety among female domestic workers. Clinical interviews with 250 housemaids from Pakistan. Domestic workers are individuals who are employed in homes for domestic work. The domestic work inside a house includes a variety of everyday household jobs including cooking, cleaning, laundry, looking after the elderly and children, doing grocery, and managing finances. Most of these tasks are associated with female gender in most of the cultures worldwide. Women are used to face social inequalities in almost all the cultures throughout the history. Although the household labor needs to be shared between the spouses, there has always been a disparity in the household responsibilities between husbands and wives whereby wives must bear extra labor inside the house. Domestic work is considered a female norm in most of the societies. People, therefore, prefer female domestic workers over men for the same reasons of social compliance to the gender roles. There are approximately 67 million domestic workers globally who play a significant part in the global workforce. According to the International Labour Organization, 1 in every 25 working women is a domestic worker. The female domestic workers work for several reasons such as poverty, illiteracy, lack of other employment skills, etc. Domestic work is not usually regulated by authorities and is not regarded like other formal jobs in which employees are well protected for their rights. Abuse and humiliation, therefore, is a common experience of female domestic workers worldwide. Several studies have revealed that the domestic workers are mostly at risk of abusive work conditions and adverse mental health. Pakistan is a patriarchal society. Islam is the mostly followed religion by Pakistanis, which originally supports the participation of women in the social, political, and economic walks of life and promotes balance between genders. The expectations from women in Islam, for example, have never been to merely perform laborious domestic work all alone. The political, social, and cultural reasons, however, have contributed a lot in the misunderstanding of gender roles among Muslims worldwide. Apart from religious misinterpretations, Pakistan is also a signatory to the Convention on the Elimination of All Forms of Discrimination Against Women, and women have been theoretically provided with equal rights and opportunities in the law. In practice, however, men dominate women in all spheres of life. Women must face several inequalities and challenges due to culture, customs, religious misinterpretations, ingrained feudal system, and insufficient literacy rates. The state of mental health of Pakistani women is worse than men. They lack appropriate knowledge on the psychosocial stressors and face several cultural barriers in seeking health-related support. Domestic work, as discussed earlier, has been culturally associated with women. Families which can afford the help of domestic workers prefer to hire women housemaids instead of men. These housemaids are commonly migrated from their villages to big cities to earn the livelihood for their families. Most of them serve as the only bread earners for their families as their men prefer to be jobless. The existing literature from the country did not report any earlier study which could have tried to assess the psychopathological conditions of female domestic workers. A study by Dr. Sukoon, therefore, was initiated to analyze the possible sufferings of female domestic workers in Pakistan by interviewing them from a clinical perspective. It was intended to interview and screen the participants against major depressive and generalized anxiety disorder, based on the Diagnostic and Statistical Manual of Mental Disorders. It was also intended to analyze their on-job experiences of being emotionally, physically, or sexually abused. The study involved 250 female domestic workers from Rawalpindi and Islamabad, Pakistan. They constituted a diversified sample based on age, marital status, education, intensity of work, and income. An interview schedule was developed for the study. The schedule included the demographic information regarding the respondent, that is, her age, marital status, education, monthly income, and number of houses in which she works, a symptoms-based checklist for major depressive disorder and generalized anxiety disorder on the criteria of DSM-5, and a checklist for the exposure to physical abuse, emotional abuse, verbal abuse, and sexual harassment. The findings revealed that 52.8% female domestic workers were diagnosed with major depressive and 53.2% female domestic workers were diagnosed with generalized anxiety disorder. The prevalence of the same disorders in general Pakistani women, as reported in an earlier Pakistani study, was significantly lower than the prevalence in female domestic workers. Depression and anxiety in female domestic workers have been commonly found in earlier studies conducted in other parts of the world. Major depressive disorder (MDD) is the most frequent mental disorder which affects more than 300 million individuals or 6% of the adult population each year worldwide. MDD has higher adverse effects on health as compared with other common physical diseases such as diabetes, angina, asthma, or arthritis. It has a potential to develop several medical conditions such as diabetes and cardiovascular disease and adversely affect the general health of a person. According to the Diagnostic and Statistical Manual of Mental Disorders A Euro, DSM-5, the diagnosis of major depressive disorder is made through depressed mood, loss of interest or pleasure, sadness, hopelessness, worthlessness, weight loss, insomnia, hypersomnia, psychomotor agitation, fatigue or loss of energy, problems in concentration, death anxiety, and suicidality. Suicide is strongly correlated with MDD, and it has been reported that 50% of the suicides are conducted in a depressive episode. MDD is also positively correlated with premature deaths. The lifetime prevalence of MDS has been reported as 2 to 21% worldwide. Several environmental factors such as loss of employment, financial constraints, exposure to violence, separation, bereavement, neglect, and abuse in childhood etc. have been associated with its development. MDD adversely affects a persona-Euro's cognitive functioning, work performance, and quality of life. MDD is also found to be more prevalent among women and occurs twice in women than men. Generalized anxiety disorder GAD is a Euro worrying about the future excessively a Euro. GAD is regarded as a chronic and impairing disorder. It is a basis for several other mental disorders and a risk to several chronic medical problems including depression and cardiovascular disease. The patients of GAD have been considered as the most common patients of any outdoor patient department in hospitals. According to the Diagnostic and Statistical Manual of Mental Disorders A Euro, DSM-5, the diagnosis of generalized anxiety disorder is made through the excessive and uncontrollable worry, restlessness, fatigue, irritability, muscle tension, and disturbance in sleep. Patients with GAD worry to avoid and reduce the ongoing distress. They have cognitive hyperactivity and highly intense perception of emotions. Other significant causal factors include negative life events, parental neglect, maltreatment, loss, interpersonal problems, etc. Women experience GAD more than men. The study by Dr. Sukoon also revealed that 51.2% of the understudied female domestic workers had experienced verbal abuse by their employers, 21.2% had experienced physical abuse, 55.2% had experienced emotional abuse, and 28% of them had experienced sexual harassment from their employers. Abuse and harassment toward female domestic workers have also been commonly found in studies conducted in different parts of the globe. The term a Euro abusi a Euro refers to the destruction of oni a Euro's self-esteem or sense of safety occurring within relationships in which power dynamics are different. Abuse may include a Euro physical a Euro aspects involving physical acts to intentionally harm someone, a Euro sexual a Euro aspects to exploit another person through sexual activities, a Euro emotional a Euro or a Euro psychological a Euro aspects to devalue the targeted person emotionally. A Euro neglect a Euro is another form of abuse in which a person withdraws from the caretaking of a dependent. Emotional abuse, defined briefly, can be any non-physical behavior or attitude intended to control, intimidate, subjugate, demean, punish, or isolate another person for the sake of gaining power over another person. Emotional abuse is generally more prevalent than physical or sexual abuse. Emotional abuse has a significant potential to be converted into physical abuse and has negative psychological effects on the victim such as depression, low self-esteem, sense of failure, hopelessness, self-blame, and self-destructiveness. The aforesaid study by Dr. Sukoon was the first ever of its nature in Pakistan. It reported the adverse psychosocial condition of the female domestic workers for the first time in the country. The study emphasized on the gender-based discrimination which is based more on the sociocultural customs of a patriarchal society rather than the religious foundations. It highlighted the problems of the most vulnerable segment of women who are the poorest and the most prone to abuse and exploitation. The study sensitized the policymakers and public to pay sufficient attention to the vulnerability of the female domestic workers. The employers of female housemaids should raise their moral standards in dealing with their workers. They should also facilitate their mentally affected workers for appropriate psychological help. Psychotherapy has been found effective in treating major depressive and generalized anxiety disorder. Future researchers are advised to explore this scenario further by analyzing the causal factors involved in the psychosocial sufferings of women housemaids. Thanks for listening. To read the entire paper, kindly visit www.dersakoon.info.